So our topic today is good sleep health, and the importance and relevance of good sleep for brain function. And I'm very happy to introduce Dr. Jessica Riggs, who is a pulmonary and critical care specialist. She works here in Northern Virginia, close to me, with the Virginia Heart Company. And Dr. Riggs is a pulmonary and critical care boarded physician. She spent several months on the front line fighting COVID-19 in New York City intensive care units, and became interested in sleep medicine during her years in the ICU. And she understands that complex medical disorders are delicately linked to sleep health and hygiene and the ability to restore good sleep health. And that she knows now that major outcomes are really important with good sleep. So Jessica, there you are. So I'd like to introduce Dr. Jessica Riggs. Jessica, I was just telling them a little bit about you and about your interest in sleep medicine and how you learned about the relevance of important sleep when you were in the intensive care unit and how much that impacted outcomes and how you developed your interest. So tell us a little bit about yourself too. What would you like people to know?
Yeah, thanks for having me. This is awesome. It's the first time doing this. So yeah, I appreciate the offer. So I did my training in internal medicine up in Jersey, and then I went over to New York and did training in pulmonary ICU. And I realized with the pulmonary training in the ICU, there's so much sleep that is involved with lungs and breathing, and so much of sleep disordered stuff has to do with breathing. And then there was a lot of information out there with the ICU and what happened when people did not sleep well or were delirious and all these things, that eventual outcomes that we didn't necessarily know would happen. But, my time there was awesome. I loved it. I stayed extra time for sleep training with a really great group, and ended up coming back down to Virginia, which is home for me. And so have been here for the past year, seeing people, and it's great.
Fantastic. And I just learned that Dr. Riggs used to play soccer. She was a soccer goalkeeper, so a position near and dear to my own heart. So that's great. Love it when we see athletes go out and do tremendous things with their lives. It's really exciting. So
thank you.
Great. All right. Well, let's go ahead and get started. I wanted to just remind people about the 5 top tips to promote and boost good brain health. And one of them, of course, is sleep. So we'll get to that one. Let me run through the others quickly for people. Of course, what we do with our own lifestyle really has a significant impact on overall well-being. And we know this to be undoubtedly true. First and foremost, we see that adopting a Mediterranean-style diet or heart-healthy diet can have a tremendous impact on many, many different aspects of a person's life. It can help to prevent cognitive decline. It can improve the risk of Alzheimer's disease, reduces risk for stroke and heart disease, helps people maintain a healthy body weight, reduces inflammation. So many positive benefits to a good heart-healthy diet. That comes first in our list. Second is exercise. Utilizing, moving our bodies is really important for overall maintenance of good health, and to promote longevity and to promote good quality of life. Because growing older is one thing, growing older fit and healthy and able to do the things that you want to do is something else altogether. And that's what we're really striving for, is that good quality of life as well. Regular moderate exercise, 30 minutes of activity 5 days a week, and that can include a brisk walk, is a really good approach to take. And then the next one is for good brain health is exercising your brain. Finding some activity that you like to do, some hobby, maintaining interest in things that you've always been interested in, reading, doing puzzles, engaging in discussion groups, anything that is interesting to you, learning a language, learning how to play a new instrument. All of those things can be really beneficial for keeping your brain strong. Your brain needs to be used, or its function begins to decline. So managing stress is another very important component, and we know that people who have developed good skills at stress management tend to fare better in the long run, and that includes for good brain health. And then the fifth thing is, which is probably really up close to the top for a lot of people, is this notion of getting enough sleep. We have learned that as a society, we are pretty good at not getting enough rest. And not only that, but health issues and other concerns, whether they be psychological, coping with anxiety and stress, or physical, developing sleep apnea or restless leg syndrome, those types of problems, not getting good quality sleep and good quality rest on a consistent basis has a really negative impact on brain health. So that's why I'm excited to be able to talk about good sleep today. So Dr. Riggs, why don't you tell us a little bit about what you've observed with brain health and rest? Like, why is getting a good night's sleep so important for brain health?
Yeah, I think the other things that you just mentioned now are ultimately super important for sleep in itself. Just doing those things throughout your day are ultimately going to be the things that control your sleep. So things that you eat, how much you exercise, what you do, how much you engage during the day is ultimately controlling your sleep. Your sleep is controlled by your brain, and ultimately your brain has many effects that come from how you sleep and the quality of sleep you get. I think sleep is incredibly important. So it's a third of your life, no matter how you spin it, and it changes throughout your life. As you age and go through the spectrum of your different life phases, your sleep is going to change. And I think how much you need, the quality you need, the different ways you sleep also changes. So I think it's important to be educated about it, and to know that ultimately getting good sleep is really important in your overall brain function. We know for sure that sleep deprivation is a huge problem for your brain, in terms of the less sleep you get and less sustained and good quality sleep you get over time can actually lead to things like you mentioned, Alzheimer's disease, Parkinson's, can lead to neurocognitive decline, early dementia, stuff like that. So paying attention to sleep and making a point to try to improve it or optimize it, I think is important, for your overall brain health. So I think I'm glad we're talking.
Mm-hmm. Great. So what tips do you have for people who may not always wake up feeling rested in the morning? What should they be thinking about? What kinds of things can they do? First of all, how do they identify when there's actually a sleep problem? And what lifestyle changes first can they put into place that might really help with the quality of night's sleep that they get?
Yeah, I think, I think what's important to keep in mind is that we're all going to have a bad night's sleep. That is going to happen no matter what at some point. But it's when it becomes sustained and it becomes a repeated pattern and becomes something that is affecting your daily quality of life, then it's something that you should think about and potentially should even seek help. If you can't, rectify it on your own. One thing that you should think about, certainly when you wake up and feel not rested, is how much time did you get in bed? So one of the first things I ask a patient is, what's your normal sleep schedule and how much time sleep are you getting? We always recommend a amount of sleep, usually somewhere between 7 and 9 hours for adults. Now, does everyone fall into that spectrum? Absolutely not. Some people need 6, some people need 10. But making a point to see how much sleep you're getting is important, because I do believe that we as a society in this country, and also more recently with COVID and things changing and working from home, our sleep schedules have changed. We've reduced the amount of time we sleep. We've reduced the amount of time that we rest. And so I think that's the first thing you should consider, is how much sleep you're getting. The next thing is a restful sleep. If you're going to bed stressed and bringing on all the worry of the day to the bedtime, that's going to carry over into sleep. And part of that is just because, again, your brain is what's controlling your sleep, and you cannot remove the things that you're thinking during the day to bedtime. So one thing to think about is what's going on in your life. Is there stress? Is there anxiety? Are there things that are causing you stress during the day that are ultimately going to descend into your nighttime behaviors? Other things to think about certainly are, pathologic things. If you're waking up with symptoms, anything like a dry mouth, a headache, feeling like you can't breathe, feeling like your heart is racing, there could be something going on. And like Dr. West had mentioned, there are a lot of sleep disorders that are not quite out there on the front page of the headlines, but they are there. Certainly we all know what sleep apnea is, or we've heard about it, or we have an uncle or a friend who has it. But there are other things. There are restless leg syndromes. There are periodic limb movements. There are seizure disorders in sleep. And then there are just different brainwave patterns that we do see. There's something called alpha intrusion, for instance, which is actually a very interesting phenomenon, which again, stress. What we see is that wakefulness and wake time alpha rhythms are intruding into your deep sleep. And that's really when you get your good, restorative, happy sleep, when you wake up feeling like, yeah, I'm ready to conquer the day. We do see data in labs that show that these kind of stressful and anxiety things that we deal with during the day do go into our sleep time. So I think, it's important to recognize, what is normal versus what is not. And we don't always do that. I think it's easier said than done, but I feel that if you, recognize that there's a pattern that you're consistently waking up not feeling well, talk to someone about it. Talk to your primary care doctor, seek help, because we are here and there are things that we can help you with.
Mm-hmm. I'm not sure that I've talked to anyone in the last year with COVID going on who says, I sleep great. I don't know if you're experiencing that too, but there are so many people who are struggling with sleep right now. And I think a lot of it has to do with just the fluctuations of, the political environment, the changes with COVID, the financial worries that people have, the reinventing themselves or discovering things that they always thought were fine that they just don't think are a fine part of their lives anymore. And it's been a really difficult time for sleep. I mean, people were home, especially in lockdown. They were home all the time, but that did not necessarily translate into plenty of rest.
I agree. And I'll tell you what we see a lot in our sleep clinic here is a lot of circadian rhythm issues. Part of what we are seeing a lot with COVID and the shift to working from home and the kids being home and this whole kind of whole country shift is that people are not practicing the same social cues and the same rhythms that we used to. So our brains are very complex but simple at the same time. So we are very in tune to light. We are very in tune to social cues like eating. We're in tune to habits. So when you take someone who has a routine of getting up at 7, getting in the car, going to work, eating lunch at 12, coming home, and that's changed to now this schedule of almost a 24-hour pattern where we're always online, we never can turn off, and things are different. It really affects our circadian rhythms and how we find ourselves sleeping. So I think this year has been very interesting from a political, social, stress standpoint, but also just very basic changes that we're seeing.
Just the rhythm of the day, trying to maintain as much normalcy as possible will also allow better sleep.
Absolutely, yeah.
Yeah, that's challenging. And I'd heard about specific, we've heard not to drink too much caffeine during the day, and certainly to limit caffeine to the morning hours if you have any sleep issues whatsoever. I'd be curious whether are there other vegetables, other drinks that create problems for people, or are there other foods or drinks that we can eat that might actually help with sleep, restful sleep? The old warm milk adage apparently actually works.
It does. It's funny. It's true. So first of all, absolutely, caffeine is we all know about caffeine. Absolutely. What is normal for us is our adenosine climbs throughout the day. So as we get up and go through our day, our sleep drive is climbing. So we are basically accumulating this drive to sleep. And adenosine is one of the things that is accumulating in our sleep drive. Caffeine inhibits that. So caffeine is an absolute wake up drug, and it's a diuretic as well. So two things that are absolutely terrible for sleep: peeing and not sleeping. So absolutely caffeine, we always recommend no caffeine after noon. Certainly that's something that a lot of people are not pleased with. And I myself have to admit that I'll have my Diet Pepsi at 2 and that gets me up. But caffeine lasts a long time. And if you look at the actual milligrams in what we're drinking, it's quite high. If you look at a Starbucks small coffee, there's somewhere around 350 milligrams of caffeine, which is very high, as opposed to a Diet Coke or a Pepsi that has something along the lines of 80. I have patients who say, well, I drink green tea. Well, green tea also has caffeine. Chocolate has caffeine. So there's a lot of caffeine out there. A lot of drinks that are infused with caffeine, whether it's Red Bulls or Mountain Dews or whatever. So caffeine is something that we all know about. It's definitely something we should limit. On the same token, nicotine is way up there in terms of something that is a stimulant for us that we should try to avoid for other reasons, of course, but just from a sleep perspective, nicotine absolutely revs up that system. But there are good things out there. There are things that are very calming that are helpful for us. Actually, magnesium is extremely helpful. I have patients who take that in a daily multivitamin or just take that on its own. And if you take that at night, it's very sedating, as is calcium. So if you are somebody who likes your calcium chews, which I do, at night, it actually is very helpful to maintain your normal sleep patterns.
What doses do you recommend for those, for magnesium and calcium?
For magnesium, usually about 250 milligrams and up. The 250 is usually the usual dose. Calcium, usually just whatever is in the multivitamin is, I actually don't know the exact dose of that because I don't usually prescribe it. You're going to take it at night. And usually better absorbed if you take it with some vitamin C. So, a shot of orange juice or vitamin C is helpful to absorb it as well. Certainly the things we know that can disrupt sleep, high carbohydrate meals right before bed can certainly cause you to boost your metabolism, not what you want at sleep time. But absolutely, warm milk is a great thing. So warm milk really works. It releases lactose and it actually helps calm your mind and suppress some of those wakefulness drives that we have. So there's a lot out there. If you Google sleep, there's going to be a ton that comes out. But I think, that the most important thing is probably going to be limiting that caffeine, which certainly, while we're all online a lot nowadays, is really important to try to reduce those things.
Yeah. I'd heard about 200 milligrams of caffeine daily is what, more than that could be problematic for people.
Absolutely.
I guess people develop a tolerance over time to some of it, but we've become a coffee generation. 30 years ago, you didn't have a Starbucks on every corner, and now people literally are drinking caffeine morning, noon, and night without realizing not only how much caffeine, but how much sugar is in the drinks that are offered.
Right,
and I think both of those can be really problematic for people. I've actually taken to encouraging people to try no caffeine for a couple of weeks and just see what happens. I wonder if the half-life of caffeine is 12 hours or something. Maybe some of it is still there by bedtime, even if you had your cup of coffee at 7 a.m.
Yeah.
And I also.
Sorry. Go ahead.
No, I was going to say, and I also think that for some reason, as women transition through menopause, they become a little more sensitive to caffeine. Is that possible? Have you noticed that?
I think it's possible. I don't know. I don't know if it is true, but we do know that as people age, and especially as you go through menopause, and there are the hormone shifts, that we start to metabolize things a little bit differently and slower. So I do imagine that could be something. And we do know that caffeine can accumulate over time. So when you're stopping caffeine and you go through those withdrawals, you do notice that there is some level still in the system. The one other thing I wanted to mention was alcohol. We have noticed that rates of drinking alcohol have gone up a lot during COVID, and whether that's as a coping mechanism or out of stress or whatnot, but drinking has gone up. And I think one of the false conceptions out there is that, a glass of wine at dinner is going to help me sleep. And I tell you, it will help you fall asleep. And that is what I hear. But the problem with alcohol, and even with one glass at 6 p.m., we do know that it metabolizes relatively fast. So what we see with alcohol use, and especially in higher levels recently with COVID, drinking a glass of wine is great, knocks you out, but the problem is it metabolizes about 3 to 4 hours, which once it does that and you go through a somewhat of a withdrawal of that alcohol, it actually is very stimulating, causes fragmented sleep, and really is quite disruptive to sleep patterns. So it is one thing to keep in mind. And certainly, after a long day, a glass of wine sounds fantastic, but it is something to keep in mind, especially if you're struggling with sleep, that even just a glass can do a number on your sleep architecture.
Mm-hmm. Yeah. Does it prevent going into the deeper stages of sleep? When you talk about sleep architecture, is that?
It does. So basically what it does as it metabolizes after it, it acts as a sedative as it goes in. And that's why you fall asleep quite quickly, because you're calm and you go into that sedative period. And it does allow you to sleep. But once it metabolizes, like I said, in about 3 or 4 hours, it actually causes your arousal threshold to lower, meaning that it's much easier for you to wake up at even the slightest drop of a hat. And so what we see, and they've done studies on this, is that you remain in the lighter stages of sleep, stage 1 or stage 2, because you're being so frequently aroused that you never get into those deeper stages of good, restorative, helpful sleep.
Mm-hmm. Yeah. Yeah, it's so important to take these into consideration. There are so many things that can impact it. Then they also talk about just a consistent wake up time, even more important than the consistent bedtime, but both would be ideal. Mm-hmm. But if you had to pick one, the consistent wake up time is the one that's going to most influence a regular sleep cycle. Is that right?
100%. And I think that is one of the other sort of misconceptions out there is the set bedtime being the one that people tend to think is the more important one. But in reality, in the teaching that I've always had, is actually setting a wake time is better. And I'll tell you, the reason being is you can control your wake time. You can always set your alarm. You can never control when your body goes to bed or control how sleepy you are. So when you're dealing with, struggling with sleep, setting that consistent wake time will allow your body to get back onto a normal schedule. And saying to yourself, you know what, I'm not going to get into bed until I'm absolutely ready to go to bed. So let's say you set your wake time at 6 a.m. and you're not sleepy till 5 a.m. Well, that night you're going to get 1 hour of sleep, which you might feel is horrible. It won't allow you to function through the day, but you will function. We all have these days where you don't sleep well and you do function. The good thing about it is that your body will recover. Your body is really smart. And if you think back to, when you had babies or when you're caring for babies, they will sleep when they need to sleep, and your body will too. So when it comes to kind of resetting those patterns, setting that set wake time is probably one of the most helpful things we can do. And it can be a painful 1 or 2 weeks as you're cycling and getting to that point where you get to good sleep, but it will improve. And that's one of the proven methods out there that we use in cognitive behavioral treatment that is really very helpful.
Mm-hmm. Right. We'll set a consistent wake time and go find some sunlight when you wake up.
Yep.
Yeah,
sunlight
help your body participate with nature and getting out.
Sunlight is huge. And I think, we see a lot of people who suffer from things like seasonal depression, the shorter light time hours, the more dark and part of that really is, again, your circadian rhythms and paying attention to what your body needs. So again, to get to this kind of basic concept, we are kind of basic, back in old timey days before we had light bulbs and iPhones and iPads, we really were regulated by the sun. And when the sun came up, that's when we got up. And when the sun went down, that was sleepy time. And part of that is our body is so susceptible. We have cells within our retina that are activated by light. So when you go outside and you are exposed to this natural kind of light, the sun enters your retina, melanopsin is secreted, and essentially your circadian rhythm is on board. When we stay away from that light, or when we introduce false light, again, your iPhone or your iPad, at night when you're supposed to be sleepy, your brain interprets that as, hey, it's daytime, let's wake up now. And so, we do a lot of things, and I can't exclude myself. We do a lot of things that are against what our natural body wants us to do.
Yeah. I've seen there's a real trend toward those light filtering glasses for people to wear. Are those any good? Do they make a difference?
They do. So the important thing is to make sure they're filtering blue light. So that's a specific kind of light. That's the kind of light coming from your iPhone, your iPad, all these electronic devices. And the reason that one's important is, again, that's the one that really triggers those retinal cells to say, hey, it's wake time. And that essentially suppresses your natural melatonin. So it tells you to wake up. It tells you to start secreting things like cortisol. So, things like, blue blocking glasses are helpful, blue blocking screens, setting your e-reader to the dim light setting, things like not sitting too close to the TV. Sounds silly in theory, but it's actually extremely helpful. And a lot of studies out there show that light is actually your most important, we call it the Zeitgeber. It's kind of a silly name, but it's your most important regulator of how you sleep and how you wake.
Yeah. Do you recommend that people get off their electronics for a certain window of time before bed? How long is the right amount to avoid electronics?
So we always say at least an hour. I think ideally there would be more, but an hour is usually enough for our body to get back to where it realizes that it's dark. So it's difficult because a lot of people love to get onto Netflix, watch our shows, and fall asleep to our favorite show. And again, I can't exclude myself completely, but turning it off, turning off the phone, not checking Facebook right before bed. These are all really important things, because even just that second of looking at your phone is going to stimulate your body again to say, hey, let's get some cortisol in there and let's wake up. So I would say at least an hour if you can.
Yeah. Let's talk about other good things for a bedtime ritual. What sorts of things are really helpful for getting ready for sleep?
Sure. I think, thinking about how you were when you were a kid, or how you took care of your kids, it's really important to have what we call essentially a wind down time. Taking all these things that you have been doing during the day or worrying about during the day, and making sure they're not coming into that space. As we mentioned, turning off the phone, turning off your screen is super important. Other things that you can do, we mentioned the supplements or the foods that are helpful. Having a light snack actually before bed is not a terrible idea. Going to sleep full, not great, but going to sleep hungry is also not great. And part of that is your glucose will drop, and basically that can wake you up. So making sure that you're not going to sleep hungry or full is really helpful. Making sure you are in a calm space. So, whether it's listening to light music, meditating, yoga, or just doing something relaxing. Before you get into bed, we used to read our kids bedtime stories, and sometimes doing something equivalent for yourself, not necessarily that, but something that will allow you to be in that space where your body can relax. You can't make yourself sleep. And sleep is one of these things where the more you think about it and the more you try, the more you're not going to do it. And so really setting up the stage so that you can be in that optimal environment. Making sure that your room is comfortable. You want the temperature low. We always recommend somewhere between 65 and 70 degrees is fine. Colder if you want, but definitely not higher than 70. You need a cool environment because your body temperature needs to drop throughout the night so that you get to a good core level so that eventually you can wake up. Making sure the bed is a good bed. If your mattress is over 8 years, we say time to look for a new one. If pillows are more than a year, time to look for new ones. Having good neck support, having good back support. So kind of setting up the stage so that you are optimizing your ability to sleep, I think is really important.
Mm-hmm. That sounds great. And when it comes to circadian rhythm, I had heard at one point, there was a New York Times article a couple of years ago about the two sleeps. I don't know if you're familiar with this, but they apparently back in colonial times, before there was a lot of electricity, people would traditionally, follow the light of the sun. So especially in the winter months, they would go to bed really quite early.
Mhm.
But what they found was that the body's natural rhythm was to sleep for 4.5 to 6 hours, then actually be awake for an hour or two, and then go back to sleep for the rest of their night of sleep. And I
Mhm.
was intrigued by this because for a while I found myself falling into that pattern. No matter what I did, that was the pattern. And, it works great as long as you can go back to bed, but not everybody is able to go back to bed once they've been wide awake at 3 a.m. So
Yeah.
I just wonder, have you seen any more to support that theory, or to, like, how do we work with that if that is in fact what our bodies want from us? Is
I
that,
have,
should we
I
just
have,
go with it?
yeah, no, I have heard that theory actually, and they call it kind of a diurnal pattern where it's like you said, it's kind of two separate sleep periods. And what I've heard is that there are different segments of people who kind of have that rhythm. The typical circadian rhythm is what we think of. It's that kind of go to sleep at 11, get up at 7 type thing. And that's based on, again, it's the sunlight. But there are this subset of people, and there are studies back in old timey days that did look at that. And we do have patients who still have that kind of pattern. One of the things that we say is don't fight it. If that is your pattern and you have the ability to have that pattern, and if that's your natural pattern, use that time. When you get up at 1, 2 a.m. and you're up for 2 hours, use it. Whether it's reading a book that you wanted to get through, reading the paper that you wanted to get through, working on a project that you wanted to get through, use that time, because certainly trying to fight that urge with medications or worrying about it or trying to change it, you might not be able to.
Mhm. So if people are wide awake at 2 in the morning, then, I think the frustration mounts and people get so frustrated about the fact that they're not sleeping that it almost compounds the problem. And
It
so,
does.
so maybe having a good book and a quiet corner to read in, or, a meditation that you want to try, or something like that, that will just help to, you not introduce a computer. Probably checking email at 2 a.m. is probably not the best strategy.
Yeah.
But having something relaxing or something enjoyable that you like at that time, or using that time for quiet time or prayer, or time
Yep.
to snuggle with your honey, or whatever, what is helpful. Just to say, okay, here it is. This is what it is.
Yeah.
And
And I,
then
and I
just
think
try to make the
another,
most of it.
yeah, absolutely. And I think, the more that you stress about it and get angry at yourself or get frustrated at yourself because you're waking and thinking about, well, how bad my sleep is only going to exacerbate this cycle of feeling anxious about it and then worrying about it. And then at some point, the bed becomes this angry, unhappy place. I think one thing that we always say to our patients is, if you are lying there and you're struggling and you're stressed and feeling uncomfortable, give yourself 10 minutes. If you get past that 10 minutes, and don't give yourself 10 minutes by looking at the clock, but give yourself an internal 10 minutes where you get to a point where you say, this doesn't feel right, out of the bed. Because one thing that we do know is staying in bed and having those negative anxiety emotions and feeling distressed is going to, over time, make you feel unhappy to go to bed. And what we want to keep the bedroom a sacred place. We want it to be a happy place that you associate only with sleeping and pleasurable things like sex. But you don't want to associate it with things that are not bedroom activities. Don't eat in bed. Don't watch TV in bed. Don't do your bills in bed. Things that are stressful. Make it a place which your mind sees and says, that's time for sleep time.
Mhm. Yeah, it makes lots and lots of sense. All right, so tell us some of the things that might be perceived as real. Like, when is it time to come and talk to you, or to talk to your doctor about really just not getting restorative sleep? What are the cues, and what's the threshold that makes you think, okay, it's time to get this checked out? There's something not right here.
Yeah, that's a great question. I think what what you're kind of getting at is sometimes we let it go. We say that it's sleep. Yeah, I had a bad night. Let's move on. And when do you cross that line of saying we should check this out? We should get it evaluated. I think when you get to the point where it's really affecting your daytime, when it's affecting how you feel during the day, if you're feeling things like irritable, your mood is getting worse, it's affecting your relationships, it's affecting your work or your ability to do things, whether from a mood perspective or the feeling that, I'm so angry at my sleep, I need something to fix it. I think if it gets to a point where you're thinking about it throughout the day, it's probably time to check it out. There are organic sleep problems, like sleep disorder breathing or sleep apnea, that, your partner will probably say to you, I saw you stop breathing. Sometimes it's very classic like that, but sometimes it's not. Sometimes the symptoms are more subtle. Things like insomnia or not staying asleep throughout the night, feeling irritable, not being able to concentrate on things. And then there are the usual, daytime sleepiness, falling asleep during meetings, getting tired at the wheel. But oddly enough, most sleep problems don't necessarily present with sleepiness. So I wish I could give you a simple when do you come. I think the probably the best answer is when it's really bothering you, when it has affected your day. And I think it's something to at least mention to one of your primary care physicians and seek help.
Walk us through a little bit of the workup. Like what, okay, let's say you've reached the point where things just aren't right. You're tired all the time. You can't remember anything. You're moody. You just never get all the way through a good night's sleep. The first thing you think of when your eyes open is where's the coffee? What could someone expect if they were to come and see you?
Sure. I think it's a great question. The first thing I start with, of course, is a history. Let's talk about what exactly is your sleep schedule. What is your pattern? What is your wind down, procedure? What is your sleep hygiene? What is kind of your overall gestalt? So getting a good, thorough history, I think, is really important. Getting a good story from a bed partner, if you have one, is helpful. What kind of things do you do when you sleep? Are you restless? Are you all over the bed? Are you kicking your partner? What's happening with your breathing? Are you making interesting sounds? Are you getting up and walking around in the middle of the night? Those are very important things for us, just in terms of how do we guide our next steps. So the history to me is the most important, and paying attention to, these kind of subtle nuances. And sometimes I find it very helpful if I don't quite get a complete history. I'll say, let's do some sleep diaries for a couple of weeks. Which is very helpful to look at what are your patterns, what time of day do you exercise, what time of day do you have caffeine, and kind of go through a day-to-day look at your overall sleep pattern is what I start with. Certainly there is sleep testing. So if there's a indication of something like sleep apnea or potentially even restless leg type movements, we can certainly send someone for a in-lab sleep study or even a home sleep study nowadays. So we do a lot of sleep testing. Part of that is there are things like sleep apnea is very common in the population, so it's one thing that we do look for. But that said, a sleep test is not necessarily indicated. So, if somebody has kind of classic insomnia, we don't necessarily need to do a sleep test. It's not necessarily going to help us. We do actigraphy, which is very similar to a iWatch, where it basically looks at your sleep patterns. Again, very similar to what a sleep diary would tell us. We do other kinds of sleep testing. There's something called a multiple sleep latency test. We use that to help us diagnose things like narcolepsy or idiopathic hypersomnia. So there's a variety of tests we do. Occasionally we'll recommend things like blood work. So there are blood conditions that can cause things like restless legs. So we look for things like anemia or iron deficiency. But we try to, the biggest thing we start with is a history. I think a lot of sleep is really talking to someone, trying to figure out what is really stemming the issue. What is really the part that's bothering you? Is it falling asleep? Is it staying asleep? Is it waking up too early? Is it the sleepiness during the day, or is it overall, your pattern of sleeping? And I think there's a lot we can gain from a good history.
Mm-hmm. No, that's great. And one of the beauties of being in a concierge practice for me is that I actually have time now to do that. And I will go through 2 validated questionnaires, Stop Bang and Epworth Sleepiness Scale, on all of my patients so that we can identify a problem. And often they don't even really realize that it's a problem until it comes to light by looking at these questionnaires and say, well, now that you mention it, I am kind of tired all the time, or I can't remember the last time I didn't have a cup of coffee when I woke up. And so those are, it's really helpful to be able to identify those things, and then to know that there are some treatment options out there. I'm curious about the iWatch. Are those a lot of people are getting into test, part of the health app.
Mm-hmm.
Do you have an app that you guys use for sleep, or how good are those? Do they work?
We don't have a specific app that we use, but we do have a lot of patients who have the iWatch now, and who have, these health monitors that are very good nowadays. Actually, they're quite good about looking at things like your oxygen levels and your heart rates, and even now they can read EKGs apparently, which is super cool. There's a lot of gadgets out there. There's the sleep number bed that tells us about heart rate variability. So there's a lot of information out there. A lot of marketing has been done in the world of sleep, which is good and bad in different ways. But I think we have a lot of information to work with. I don't think all the information is perfect, but I think, they're pretty good surrogates. The iWatch in particular, when it looks at sleep, so there are sleep apps that look at your different stages of sleep, or your different lightness or deepness of sleep. It's a good surrogate. So, looking at different sleep stages, what we see with a normal sleep pattern is, as you go into the deeper stages of sleep, your heart rate starts to decrease, your blood pressure starts to decrease, the variability between the heart rates will decrease as you go into your deeper delta sleep. And then it pops back up during REM. So we see essentially a wakefulness picture when you're in REM sleep, which is your dreamlike sleep. So what these watches will tell us is, were you in deep sleep? Were you in light sleep? Did you have bad sleep? Did you have good sleep? And they are based on these kind of, heart rate measurements, and overall, surrogates for actual sleep. Nothing is going to tell you exactly about what stage of sleep you are in unless you come in for this formal diagnostic study, but they are pretty good. The thing I would say is, don't focus on them so much that you drive yourself nuts, because I think if we watch the heart rate too much, you get to a point where you start focusing on it, and if overall you still feel well, then it may not be the best measurement for you.
Mm-hmm. Mm-hmm. That's really, really interesting to watch all of this evolve and see what's out there.
Yeah.
And what we're also seeing is the evolution of different treatment strategies. I think most of us are pretty familiar with CPAP as a treatment for sleep apnea, but now we're hearing about all of these other options, fitted mouth guards and things, rests that you put under your pillow, and all these different strategies that people are trying to improve that snoring that comes when the airway is starting to close off. Do you have any particular favorites with those, or anything that you can recommend that people try at home?
Yeah, I mean, there's some cool stuff out there. I'll tell you, there's a lot of interest, I think, in sleep apnea, again, because it's just so prevalent in the population, and I think people have started to realize that there are other options besides CPAP. So CPAP has been around since the 70s. It's the oldest treatment. It's one of the tried and true treatments. And the thought being that it stents open the airway. So you have a box with a tube and a mask, and it blows in air at a pressure. And that's opening up the back of the airway. The airway is very collapsible, especially at night when you go into the deep stages of sleep like REM, because everything paralyzes. Your whole body is listless, because otherwise you'd be acting out your dreams. And so you don't have the normal musculature to open up the airway. So the idea of CPAP is opening up that airway. So there are other things that do that. We have oral appliances. So something called a mandibular advancement device, something a dentist would make for you. It's actually pretty neat. The idea being that the lower jaw is pulled forward slightly. So it's a night guard people use with a slight advancement of the lower jaw, which actually pulls the mandible and pulls the tongue out of the way of the airway. So if you think about, or if you think about an episode of Grey's Anatomy when the EMTs are intubating someone, they pull the jaw forward. And that's essentially what this thing is doing. It's opening up the back of the airway. That's a great tool. One of the other cool new things on the market, the mandibular advancements have been around for a while, but one of the newer things, and it's not so new now, but it's about 8 or 9 years old, is the Inspire device. There's a great commercial on right now about Inspire. It's a bunch of people sitting around in a support group with their CPAPs on, and they're upset, and they're talking about Inspire. And it's this actually pretty neat concept. It's a hypoglossal nerve stimulator. So it's essentially a pacemaker for the tongue. It's a small pacemaker, goes under the clavicle. It has a wire that goes into the diaphragm and a wire that goes to the hypoglossal nerve, which stimulates the back of the tongue. And so what you do is you have this implanted by an ear, nose, and throat doc. You take home a remote control, and when you go to bed, you turn it on. And essentially what happens is you take a big breath, and this stimulates the tongue to protrude forward. So it pushes the mandible forward. Again, very similar to the dental device, but it's inside, and there's no plastic, and there's nothing you can see. And so that has become very popular with several of our patients and has shown very good results. There's something out there, it's called Excite OSA, and it's basically a little gadget that you put in your mouth, and it stimulates the back of the tongue. So you use it 20 minutes a day, 6 weeks, then you start to taper that to once a week, and it basically strengthens your tongue muscles. And by doing that, it pulls the tongue out of the way. It strengthens your tongue so that as you sleep, it's not flopping back into the airway, causing snoring, causing mild sleep apnea. So there's a bunch of stuff out there. The companies are working left and right to keep up with the demand, and they're coming out with some cool things.
Wow, an exercise machine for your tongue.
Yeah. It reminds me of I don't know if you remember the Shake Weight, but it's kind of like that for the tongue. It stimulates. It's kind of cool. It's very neat.
Oh, wow. I think it's great if these things work, and they're probably, because a lot of people really struggle with CPAP machines there. And I know the masks and the fitting and everything has gotten a lot better, but it can still be tough, especially if you have patients who have claustrophobia. That seems to be a big group that really struggles with this CPAP.
Yeah. It can definitely be tough. I think it's one of these things that, if you get through the initial week or two getting used to it, it's fantastic. It works really well for people. People love it. But it's something, it's something to get used to. It's like if I told you to wear ice skates to bed, you wouldn't like it at first, but eventually you get used to it. We have a lot of CPAP users who will never leave home without it, and they have really benefited from it. And the companies out there have really made a big effort to improve the modalities and the masks and the comfort, and it really has improved quite a bit since it when it first started.
Well, some of the risks associated with not treating are very real. Then there's the increased risk for not only diabetes and weight gain and blood pressure problems, but right-sided congestive heart failure and, coronary heart disease and an increase. I actually saw recently there's a 3-fold increased risk for various kinds of cancer, and not only cancer types, but also the risk of actually having cancer mortality in patients who have cancer, just all because of the sleep apnea issue alone, which is pretty remarkable how much better we understand all of those things. I will never forget, as an intern, taking care of a 30-year-old gentleman who was in the intensive care unit dying from sleep apnea because he had it for so long, most of his life, and it had gone undiagnosed and untreated, and he had terrible heart failure. Then he wasn't going to make it, which is it's just amazing to me how really severe it can. When it's bad, it's really bad. So yeah, absolutely. I mean, it's interesting to see some of the the studies, and what we see is what we look for is oxygen desaturation. So what we see are
obstructions of the airflow and ultimately your oxygen going down. Well, that's happening multiple times throughout the night. That's essentially starving and drowning the brain. So we do see a lot of effects from it. And the very interesting thing is some people have no symptoms. And so, it's really important to pay attention and listen to your bed partner if they say you are sleeping funny, or if you have a family history of it. It is important just to keep it on the back burner and keep it as something that could be causing something. It could be causing an arrhythmia or hypertension that's difficult to control, and keep that on your mind as something that you should consider at least speaking with your primary care doctor about.
Yeah. Lastly, I do want to address just for a minute or two, there are so many different tips and tricks, but there are also medications. People are reaching for medications because they think it's going to help them get the rest that they need. And I think it's pretty apparent to both of us that the meds aren't necessarily the right answer. They can be beneficial for people who have been really sleep deprived for a long time, but they're fraught with their own problems. And I wanted to just get your thoughts on some of the over-the-counter stuff that I know people are reaching for left, right, and center, the herbal formulations and the melatonin. And melatonin, I think there may be some evidence to support, but especially people who do shift work or people who are struggling with jet lag, like a short-term acute sleep issues, that the melatonin can be helpful. But what do you think about melatonin for chronic sleep at nighttime?
Melatonin it's an interesting thing. It's something that's out there. It mimics our own melatonin. It really became in favor for sleep docs prescribing in terms of a circadian rhythm disorder medication. So what we think of melatonin is melatonin, the M is a magnet, so it pulls sleep towards it. And what it's used for clinically, that we often use it for is delayed sleep phase. So, imagine your teenager who decides to go to bed at 1 o'clock, 2 a.m., but then they need to go to school at 6 a.m. Their rhythm is shifted. Their normal circadian rhythm is shifted into a delayed pattern. And so we use melatonin as something to pull that circadian rhythm back towards a more normal or more sustainable pattern. As a sleep medication for, as a treatment for things like insomnia or just trying to go to sleep, it's not perfect. It's not ideal. It does work on the M1 and M2 receptors to pull your sleep. And it's good often for helping you stay asleep for a little bit because it does work on that circadian rhythm, but it's not a great medication in terms of maintaining your sleep for the long run. It's as drugs come, it usually has relatively few side effects. But again, it's a medication. It's not FDA regulated. So oftentimes these melatonin formulas have other things in them. So it's important to look at the bottles and see what other ingredients are in that melatonin. But as a overall, just what to use over the counter is extremely popular. A lot of people use it. I think for some people it works really well. It's definitely not what we recommend, straight off the bat. I think important to think about with sleep is, what really is the underlying problem? Is it stress? Is it a circadian rhythm? Is it poor sleep hygiene? Is it something that we can address with pharmacologic things first? Because certainly drugs or supplements can help you relax, can help you get into a calm state. We can certainly give you prescription medications which can sedate you, but there's nothing that we can do to induce sleep. That's your brain, that's your body's control, but we can do things to, again, optimize that environment. So I guess my overall answer is I think melatonin works for some people. I don't think it's for everyone. And I think it should be used with caution. It should not be escalated in dose. It's one of these medications that has a plateau effect. So usually once you get above 5 milligrams, it really doesn't have any additional benefit. So it's one of these medications that, tacking on 1, 2, 3 tablets isn't really going to be beneficial for you and might end up making you feel more groggy and worse than you began with.
Well, and the endocrinologists that I've worked with are are not huge fans of melatonin because it can actually suppress some of the pituitary function, and it has like a negative feedback loop with estrogen. And so postmenopausal women are thinking, wow, melatonin's the answer, it's going to help. And they say, well, if a little bit works some, then more will work better. But you do hit a point where there's a diminishing benefit, where not only that, but it can actually induce hot flashes. If you get up to the 7, 8, 10 milligram dose, you can actually trigger hot flashes, and the hot flashes may be the reason the woman isn't sleeping in the first place. So
100% agree.
Yeah, it's challenging. It's the all things in moderation rule once again.
I think it's tough. It's marketers have realized sleep is out there, and it's something that when you can't sleep, you are going to do everything you can to try to find a way to sleep. And one of the things that we naturally look for are what kind of medications are helpful. And you go into Target and there's almost an entire aisle of different, sleep aids. But I think, before you jump into any of them, talk to your primary care, talk to your doctor about it. Because even things like Benadryl or things that are over the counter that, we assume it's over the counter, so it's fine. They all have side effects, and they all, over time or even in a short amount of time can be something that's just really actually counterintuitive and not really helping your sleep.
Leads to another problem. That isn't helpful. So great. All right. Well, thank you so much, Dr. Race, for being here tonight and for talking with us about sleep and good sleep hygiene and sleep and brain health. It's been really fun to talk with you. I appreciate it.
Yeah, it's been awesome. Thank you so much.
Yeah, I've been keeping an eye on the questions. If you all have questions, please go ahead and let us know. And anything that we don't answer now, we can certainly answer after the presentation. But I think we had several questions that I sort of worked in. I think we got to all of them. So it's good. So, well, I hope that we get to do this again soon. And I really appreciate all that you're doing for our patients. And I look forward to having a chance to talk about this again.
Yeah, absolutely. Thank you so much. It was great to talk to you.
Yeah. All right. Take care.
You too. Bye.
All right. Thank you all for listening in, and we'll see you next time. Take care.